Hey everybody, I'm Dan with marketing at Chase Brexton. I'm here with Amit Dhir, the nurse practitioner with our Infectious Disease Center of Excellence at Chase Brexton. And today we wanted to get on a call and chat with everybody about monkeypox. Everybody's talking, everybody's asking questions. So I wanted to pose a couple of questions that I got to Amit, and I know Amit has also gotten questions from patients. So we just wanted to dispel some rumors, spread some facts, give some resources, and if you have any questions, put them in the comment boxes, and we will try to respond to them as we see them. And with that, hi Amit, thanks for joining.
Hi, Dan. Thank you. I'm excited to talk about monkeypox.
Yeah, so I guess to start, are there can you maybe, since there's so much information going out there, what are like the three biggest points you would want to tell somebody about monkeypox?
So yeah, there's so much going on with monkeypox today, all over the U.S., all over the world, not just the U.S. I think the top things I want people to know and understand that about monkeypox um, is, I guess, the most common things that are going around, knowing the signs and symptoms of monkeypox, and how it spreads, and lastly, how we can prevent it as a for ourselves and for our communities, really. So when I talk about signs and symptoms, monkeypox presents most commonly. Now we're seeing as it's spreading across the world. In the US, it's spreading more like a rash, right? Like with blisters and pimples. But it also can constitute other types of flu-like symptoms like fever, headache, body aches, muscle aches, swollen lymph nodes, chills, respiratory symptoms like nasal congestion and cough. Um, and the rash I'm talking about, the blister and pimples, can be located anywhere, really. Face, hands, arms, on the genitals. When I talk about genitals, it could be anywhere like penis, vagina, anus, and everywhere else. Like anywhere that skin is present, it can be present where a person comes in contact. Um, and a lot of the times, these symptoms are just only the blisters and pimples, only just the rash. And sometimes the rash is followed by the symptoms I just talked about, the flu-like symptoms. That's the most common thing I want people to know when it comes to signs and symptoms. The second thing I was talking about, how it spreads. So for people to understand that, monkeypox can spread to anyone through close personal skin-to-skin contact, including if you are coming in contact with a monkeypox rash or scab or body fluids of a person who's infected, or a rash you are unsure of, you don't know what it's like, just be cautious about it. You could be touching objects like fabric, clothing, bedding, towels, on surfaces that have been used by somebody who has monkeypox, and also coming in contact when we talk about face-to-face, contact. So respiratory secretions, you can also get it that way. So face-to-face could be kissing. That's where you could exchange bodily fluids in addition to having, sex. And other things hugging, like I said, massaging, another thing. If you're going for a massage, you don't know if the person had monkeypox, like scabs on their hands or something, and they could be massaging you for a long time, up to an hour sometimes. So those things need to be very careful of. Lastly, prevention, how we can prevent it. We can prevent it just, mainly largely through taking hygiene precautions, cleaning your surfaces, cleaning your hands. So, wash with soap and water. You have access to that. Otherwise, regular hand sanitizers that work also. And also, if you think somebody might have come in contact with your beds and sheets and towels, wash it. So those are important things to consider. And avoiding, close to close contact habit. Who you might be, or who you might think might be suspicious of monkeypox rash, right? Avoiding skin-to-skin contact also, like kissing, because you might not know if somebody has a rash maybe under their lips, So these are the top 3 things I want people to know and consider.
So as you were talking, I had 2 questions of my own that kind of came up. One about how contagious is monkeypox. So if if it turns out that I have monkeypox, how long am I contagious for? And how is it actually spread from me to potentially somebody else?
So one, I always find viruses so cool. I think it's part of the infectious disease nerd out of me that, I find, every virus so cool. So monkeypox is unique on its own where it's not contagious till you have symptoms. So once somebody has symptoms, yes, it's contagious. And symptoms can appear following the infection as soon as 4 to 5 days after. And the illness can last up to 4 weeks till the scabs has dried off, fallen off, and the fresh skin has come back on. So during those times of symptoms, you are contagious and infectious. You can spread it to other people.
And then I guess the other question I had was, so we talk about sort of the rashes and the pimples and the lesions, and how would somebody who hasn't seen a provider, who may not have any other, who may not have flu-like symptoms, but just have sort of those like skin abrasions and lesions, or 1 or 2, how would they be able to sort of determine if it's just, if it is monkeypox or if it's just like a regular kind of skin outbreak that isn't, virus related?
Yeah. So, if somebody didn't have access to a healthcare provider, which I hope people can have access to, a provider, maybe they don't have a personal primary care doctor, but they have access to urgent care, a nearby area where they could possibly go to. But otherwise, just identifying how a rash could look like when it comes to monkeypox, it's just not a regular run-of-the-mill rash. These rashes look like those bumps and blisters, which can be pus-filled or mostly they look like open sores as well. So just knowing that, just a red rash appearing, it's not monkeypox. And also, if you have a rash, just be overly cautious. If you think you might have had exposure and you maybe were involved in any activity that could have been exposed to you, and somebody might have called you and told you they have monkeypox, if you do think you have those pus-filled bumps and open sores, reach out to a local center. You might not be a patient there, but you could establish care there. Every center, when it comes to primary care, most centers, I would say, accept patients when they want to engage in care.
Yeah. And what exactly is how does one get tested for monkeypox? Is it similar to sort of a COVID test in application?
Yeah, so it's not a nasal or a throat swab per se. The test, although it is a swab like any other, swabs we do for any viral infections, but this is a swab of the actual lesion. So before, I think CDC first released that, we have to arrange testing with health departments, but now, regular labs like Quest and LabCorp are running it. Now, they cannot go directly to Quest and LabCorp. They have to come to a doctor's office so they can swab their lesion, or the pimple or the blister, and send it to the laboratory for results.
And how long does it take for somebody to potentially get the results back?
It varies. It can come back, I would say, within 7 to 14 days. But, like COVID, as the cases increased, that might overwhelm our healthcare system, and that might take longer in the future, right? So all this is very new, very fresh. We're still learning a lot about this virus. And similarly, we're still doing our best in the healthcare system to sort of, do our best to see patients and take care of them appropriately. So things might change in the coming weeks, even, not even months, as the cases are developing more.
And I should say too, just because we're not live, we're recording this, and we're recording this on August 4th, so early August. And as you said, Amit, anything can change in the coming days, weeks, months, and will change. So something for everybody to keep in mind with that. Is monkeypox deadly?
So monkeypox is not deadly or fatal. There are, a couple strains of monkeypox, but the one that's spreading around, it's not fatal, and it's self-limiting disease. Although there have been a couple of deaths reported in there's, I think, one in Spain or Brazil and UK. Don't know the extent of the disease now by itself, because it's a lot of the things we have to take into consideration, what other person's underlying illnesses were, or they had other comorbid conditions that could play a role in getting extensive disease.
So I guess I wanted to also back to your about testing. So say if you have symptoms, you get tested. It's going to take a couple of days right now to get the test back. What should folks do after they've kind of gone through that process?
So once somebody is suspicious of monkeypox, if somebody have actual lesions or symptoms, then obviously they should isolate at home. That's the best thing to do. And once the results come back and we rule out an infection, then obviously we can make a medical decision in terms of if you do need to isolate or do not need to isolate. Now, if somebody's exposed but don't have symptoms, they do not need to isolate. At least that's what the information we have currently from CDC.
August 4th, current, right?
Yeah.
Are there any treatments if one gets monkeypox? Is what happens if you sort of test positive for monkeypox?
So, like I said, monkeypox is a self-limiting disease. So most people who test positive do not need treatment. If somebody does need treatment, there are specific guidelines for it. There's no direct specific treatment for monkeypox. There has been treatment, developed that has been on the market that has been used in the past for smallpox. And it's an antiviral agent, tecovirimat. I think I'm not saying it right. It's TECOVIRIMAT. And it's only being provided by CDC under expanded use, means compassionate use, where it does require mounds and mounds of paperwork to get access to that drug. It's not available directly in the pharmacy. So I think that's one of the things we have to consider. Everybody's not going to need the treatment. It's self-limiting, not fatal, not deadly. Hopefully most people can isolate and be well. And otherwise, if somebody does need treatment, there are specific inclusion criteria per CDC who may or may not treatment. So I will give two examples, maybe somebody with severe comorbid conditions, illnesses, who might be at risk for severe disease from it, or somebody with immunodeficiency syndromes like cancers, HIV/AIDS, things like that. So in those cases, somebody may need treatment.
Yeah. Okay. One of the things in terms of transmission, and you touched on this a little earlier, and I just want to maybe put a fine point on it. I think a lot of folks in the community, as they're watching all of this media, are sort of associating monkeypox and getting monkeypox as a sort of as exclusively like a sexually transmitted disease, but that's actually not the case, correct?
Correct. So monkeypox is not a sexually transmitted infection or a disease. The simple fact that it can certainly bypass the bodily fluid part of the body and still get passed on to other people, right? So skin to skin, and close face-to-face contact with respiratory droplets, you can transfer to other people. So yes, it can be transferred during a sexual activity, because during a sexual activity, you are very close to someone, right? So that's the risk factor. That's what we've been talking about, skin to skin contact. Current surveillance and studies are underway looking at how much the virus is found in a body fluid like a semen. From what we know right now, it present in vaginal or penile fluids in a very, very small amount. So it's not thought to be sexually transmitted. But again, today's August 4th, and as we develop more information in the coming few weeks, we'll certainly update our community about that.
Yep, and just as a highlight for everybody, we at Chase Brexton, we set up a monkeypox page where we're sharing resources and information. We have an FAQ that's chasebrexton.org/monkeypox. So we will update that as we get information as well. Something else that we've seen a couple of news stories about are recently are the first cases of children who have been diagnosed with monkeypox. So I guess can kids get monkeypox, and if so, is the illness more or less severe for children than an adult?
Very good question. So as we know, we currently have about 5 cases. I think I was looking yesterday, just monitoring like how the cases are developing. So 5 cases in children, and experts, pediatrics experts have weighed in, and they've talked about how severe it could be in kids. Now, children less than 8 years and younger, per CDC, are considered one of the individuals at highest risk for monkeypox. Possibly due to reason, their immune systems might not be completely or fully developed or as strong as an adult, so they could be at risk. And understanding that, kids by itself might not be at risk, but we have to understand who do they surround. Children less than 8 years old living with adults at home, or if going to even younger kids going to daycare and stuff, they are managed by adults, right? And we don't know where other kids are coming from in terms of their homes. So if kids are getting it, they're getting it from, I would assume, other adults living at home who might be at more of a risk than in terms of acquisition and passing on. But kids definitely, I would say less than 8 years older, could be at more risk. But for now, I don't want people to freak out in terms of, my kids would be in daycare or school, like touching doorknobs and things like that. Again, it's monkeypox is spread through prolonged exposure. So you could be in buses. Yes, it's a risk. Gyms risk, doorknobs risk, but it has to be a long exposure to certain things to catch it.
When you say long exposure, is there, and I know there is no finite answer, there's no timeline, but what are you talking about in terms of a time frame for that?
So when I talk about exposure, long exposure, if we were talking about like face-to-face contact, somebody in close proximity, I would say somewhere over 15 minutes or closer to 30 minutes or more exposure, where let's say you are at a rave party, clothes are, your shirt is off, you are constantly in touch with somebody, your skin is touching other people. But if you're simply touching a doorknob, opening it and walking away from it, that's not necessarily a prolonged exposure. And it can last on surfaces, per CDC's report, up to 15 days on some surfaces. So, again, if it's lasting on the surfaces, let's say if it's at your home, that could be considered prolonged exposure because you are inside your home for extended periods of time. And if somebody in your home has monkeypox or possible suspicion of monkeypox, and they're touching those surfaces, right? So it totally depends on the situation, how long, where, and when.
Yeah, I remember we were speaking yesterday, and one of the in terms of prevention, one of the cool things that you said that I didn't even think about was, and I know everybody's sort of like, oh, can I get it from a doorknob? Can I get it putting on clothes? Can I get it on a bus or on the pool or in the gym? but that idea of like wiping down surfaces and the importance of doing that, like similar to how we've been doing with COVID, right? Or like going to the gym and not trusting necessarily that the last person sort of wiped out. So like kind of take your own precautions and do it yourself. I think that's, that's we're kind of back there again, but yeah.
Yeah, and speaking of gym, a lot of times when I go to gym, I see like you easily spend 1 to 2 hours in a gym, right? So if you are working on an equipment, let's say you're lifting something you didn't clean, you could be lifting for a good 30 minutes, something heavy, and people spend a lot of time in the gym. So depending on how long you're exposed to something, risk does increase. Now, it's not waterborne, so in pools, it's not a risk. Right?
Mm-hmm.
So they have little saunas in the gym, where people usually are not wearing clothes and are sitting close to each other. So if you're touching, so that's certainly is a risk.
Yeah. Now, moving on from just general information about monkeypox, I wanted to we also got we get a lot of questions about vaccines and vaccinations and getting vaccinated. So I guess can you kind of give us an overview of what generally getting vaccinated for monkeypox looks like right now?
So right now, getting vaccinated for monkeypox in Maryland, it's not so easy, just because the supply is so limited, and whatever supply is coming on right now, at least from what we've heard, it's all government, federally controlled. So whatever supply is coming to, for example, the Baltimore City Health Department, it's sort of controlled by who they're giving. So they have identified people, and they have a very specific criteria who they are gonna give right now and continue to give. Initially, when the first few couple hundred doses came, they were, making sure that people who are exposed and people who currently have symptoms are given priority, which we totally understand. But I hope the response really improves as in the coming weeks, and our response improves as compared to other countries, actually, where there a little more better access and to vaccines, and also patients are able to reach out and have access to personnel to get scheduled for vaccines.
Yeah. So I think what we have been telling folks who have been asking us in marketing about vaccines is we're really pointing folks to their local health departments, and they are the ones that sort of have the vaccine, or the information about the vaccine that they're getting from the state, that they're getting from the CDC. So if you want information about how to get a vaccine wherever you are, look into information from your local health department, and we'll do as much information as we get at Chase Brexton, and vaccine availability. If and when it becomes available, we will definitely be posting that on our website and social media channels. Then I guess I also wanted to ask, because there was a lot of conversation around the safety of COVID vaccines, and there's a couple of in these social media posts and comments and things where people are sort of asking if the monkeypox vaccine is safe. So can you speak a little bit on the safety of the vaccine?
Absolutely. So when it comes to the monkeypox vaccine, specifically Jynneos that we are giving and are going to give, being distributed all over the US. So in the current research and literature, the Jynneos, it seems to be effective, at least from the data we have gathered from the current trials. Now, what the vaccine is going to do in this current outbreak, we don't know. But we do know that this vaccine has also been approved for smallpox, and it has been proven effective in animal models also. And based on that, we are alluding to the fact that it's relatively safe and effective. Now, so far, I've heard people who have received it from in other states, and they have done relatively well with mild to no symptoms. When I say mild, they might have had a body ache for a few hours, but that's it. So yeah. I would say similar to COVID vaccine, we shouldn't suspect any severe side effects of this vaccine. But again, we are people, and we're always going to be on the caution side. Not everybody's going to trust the medicine. People have their own just a mistrust in medical system from years, things like research and stuff, what things have happened in the past. So, but what I recommend patients and the community is that reach out to your healthcare providers to have a good conversation about the vaccine, not just make a solo decision, just going on internet and finding something which is completely wrong and negative. And when we go on internet, if we look for negative things, we're going to find negative things. So have an honest conversation with your healthcare provider, look for medical literature that talks about the vaccine, and make your informed decision in collaboration with your healthcare team.
Yeah, that's such an important message. Thank you for saying that. One thing that we also have been chatting about, you mentioned Jynneos, and there's another vaccine, and there are some folks who have been vaccinated for smallpox in the past. So for those people who have received a smallpox vaccination, I guess when they were younger, are they protected from this particular outbreak of
Very
monkeypox?
good question. That's a very good question. I've had a few patients who ask me that. So now, people who have vaccinated against smallpox may have some effectiveness against monkeypox. From the current literature, it talks about that it might be, some effective, maybe up to 85% effective. But to be honest, smallpox has been eradicated from the US. The last sort of the batch of vaccines was given around the 1970s. So anybody who was born after that is really not protected, right? Yeah. Because they didn't get the vaccine, we've eradicated it. So people who have gotten it, they may have some effectiveness, but if they have risk factors currently, we cannot always tell if somebody got vaccination, 40 years ago, if it's effective today. We have no way to come to that conclusion. So I would still recommend that people get vaccination to protect themselves.
So essentially, if somebody did get a smallpox vaccine in the early 70s, they can still, or it wouldn't be detrimental to get this new vaccine.
No, absolutely not. No, it would be completely fine. With vaccines, we are all about giving some immunity to protect, right? With COVID vaccines, we have now, depending on if you have a certain medical condition, you've gone up to 4 vaccines, right? Mm-hmm. So it's all about giving somebody a strong immunity and preventing a viral infection.
Yeah. All right. A million-dollar question in terms of vaccination. It's two-sided. So who should get vaccinated, and conversely, are there folks who should not get vaccinated?
So currently, Jynneos vaccine is safe and effective for everyone. So if somebody's at risk, they should get it. Nobody's excluded from the Jynneos vaccine, from what we know so far. In terms of who should get vaccinated now, I think when it comes to a pandemic and where we're dealing with something very urgent, we focus on obviously the population that's the most affected. If somebody belongs to the high risk class, the categories identified by health department, CDC, they should consider getting vaccinated. Somebody who's at risk for just getting monkeypox due to their close contact with people. They might be working in a job where they're constantly in a close contact, where they might not be wearing clothes. People might be working at events or venues where, in tropical or hot areas in the United States where they might not be wearing clothes all the time, but might be getting in touch with people that. Also laboratory workers who are constantly handling monkeypox specimens, other healthcare workers who might be coming in contact should consider getting monkeypox vaccine. And obviously right now we are seeing that that monkeypox is disproportionately affecting our, gay and bisexual men. If you don't have to be high risk just because you're gay and bi. If you fall into the risk category in terms of, if you have multiple partners, again, it's all about skin to skin contact. If you have multiple partners, you might be coming in contact with their skin often or for longer periods of time, consider getting vaccinated. Your sexual orientation has nothing to do with your risk.
Yeah. And again, just to underscore the point, it is not a sexually transmitted disease or infection. It's all about skin to skin contact, right? So we're going to keep repeating it until people it's memorized.
I absolutely agree.
And then one last question. This is kind of on the mental wellness side, but do you have any tips for folks on handling sort of like shame or embarrassment, like if they do get ill with monkeypox or they've recovered from monkeypox and now they sort of have this, what they feel like a proverbial kind of scarlet letter?
So I think as a community, we need to do a job for ourselves and for others to educate ourselves that if somebody does get monkeypox, it's not a lifelong illness. It is something you got it and you are going to be over it in a few weeks, and then it's not affecting you for the rest of your life. You don't have these lesions forever presenting on your skin and infecting everyone. Similarly with other viral infections, we've learned that you get it, if you do get infected, you isolate, quarantine, and then you get better, right? In terms of I want also the people to understand that and know that we as healthcare providers, we are there for them. And if they do think they have a monkeypox rash or they're exposed, really reach out to their medical team so we can sit down with them. Telehealth works perfectly fine. Call us from your home, and then we can talk about monkeypox. We can talk about measures. They can prevent it if they're exposed, and if they have it. And if they're having pain from it, we can probably help with that. And otherwise, hopefully the vaccinations become available more so we can vaccinate them, because it's recommended if somebody does get infected, if you vaccinate them as soon as possible, between 4 to 14 days of the infection, you can really curtail and blunt the viral disease and the infection. So don't feel stigmatized. Reach out to your medical team and get tested and treated or vaccinated if you have to. It's all about taking care of yourself. The sooner you talk to a healthcare team member, your doctor, your nurse practitioner, the sooner we can take care of you. And really educating others. If people don't believe what you have to say, you can certainly point them to, reputable resources like CDC, health departments, to help them understand. But I think as a healthcare, team, and as all medical centers in Maryland and across the nation have a duty to educate our communities, I think we should be spreading also the right message on our social media to educate people about what monkeypox is, how it spreads, how it's prevented, and it's really not deadly, fatal, or a lifelong disease.
Yep. that is a great way to lead this off. I know we've been chatting for a while. Amit, any last words, thoughts, things you want to share?
No, not really. I just want, just what we all already talked about. Just want everybody to know that that monkeypox is, spread via skin-to-skin contact. So avoid those long, prolonged contacts with other, use prevention as a method to protect yourself. Hygiene, hygiene, hygiene. Cannot stress enough, right? Get vaccine when you can, and educate each other. I think that we are in a position right now after we have dealt with COVID in the last 2 years. I think I guess I should not assume, but we know better to how to communicate better with each other now and really spread the right message.
Yeah. Thank you so much for sharing all of your knowledge and expertise with us. And if anybody wants any more information on monkeypox, health department pages, their CDC pages, all of those things are linked in on our monkeypox page at Chase Brexton, which is chasebrexton.org/monkeypox. And again, if you have any comments, feel free to email us or share them in the or comments or questions. Share them in the comment boxes, and we'll keep an eye on and see if we can get some answers for you. Amit, thanks so much.
Thank you for
until
having
next
me.
time.
Yes,
Yeah.
definitely. Thanks. Bye.
Talk later. Bye.